We hope everyone's having a fantastic day. I got a call earlier today from one of our members asking questions about dates on the claim form. So I've asked Dr. Mario Fucinari to join us for a quick conversation about date requirements on the 1500 claim form. Thank you for joining us today, Dr. Fucinari.
Well, thanks, Mark. Always a pleasure to help out members of the ICS.
Great. Hey, the question really centered around two major boxes, and we'll throw in another as well, but box 14 and box 15. And the question was, what does that look like? Which of these boxes do we actually have to use for each one of the claim forms that we submit? What information do you have for us?
Well, box 14 is a requirement for every insurance, really. And, Medicare has changed the meaning of box 14, but box 15 has really become a moot point here because box 15, in its original meaning, used to be for pre-existing conditions, but of course, the Patient Protection Affordable Care Act, Obamacare, did away with pre-existing conditions. So local carriers may have changed box 15 rather, to say you use this for this. But really, unless it's some local carrier, the national carrier such as Medicare and commercial carrier like Blue Cross, Aetna, and things like that, they don't really use box 15. Okay, so box 14 is the big one.
Okay, great. Now, so box 14 though, what exactly should go into box 14?
Well, keep in mind box 14 is the date of current illness, injury, or pregnancy. So illness would be non-traumatic. Injury, of course, is traumatic. Last menstrual period, if you are a specialty practice treating patients doing obstetrics, then you would use that for the last menstrual period. So box 14 for commercial insurance. Now, when I say commercial insurance, that's your Blue Cross, Aetna, United Healthcare, those kind of things there. That would be and I'm quoting here, the date that the symptoms first manifested themselves, which means like when did you first start to feel carpal tunnel syndrome or an actual injury, okay? And so that date, or as close as you can surmise that date, goes into that period of time. Now, on Medicare, of course, Medicare says it's the date you first began treating the patient for that condition, and I'll expand upon that condition, which is that condition listed in 21A. Okay, so 21A, if you put a M99.03, when did that start? It would go in that box there. Now, of course, you would have another diagnosis along with that M99.03. But then the patient comes in, they have an aggravation or they have an exacerbation of their neck. And so now you would put M99.01 with a medical condition, and then you would change box 14. So box 14 is a big deal when it comes to Medicare, because Medicare looks at that to see how long you've been treating the patient for a certain condition.
Okay, now what about date formats? Should they use 6-number formats or should they use 8-number formats for their dates? In other words, should there be 2 digits for the year or 4 digits for the year?
4 digits for the year are the actual the directions there. Now, I've had some doctors say, well, we just put the 2 digits, and then I always ask them, do you send your claims through a clearinghouse? Keep in mind, a clearinghouse, they use their software to edit any mistakes that are on that claim form, so it may be being changed and you don't even realize it here. But typically, it would be a 2-digit month, a 2-digit day. So even if it's the 7th of September, it would be 0907, and then 2019 or 18, whatever year it is. That's the format you use typically.
Great. Now, what about box 19?
Well, box 19 is kind of like a storage bin, okay? It's like whatever you want to put in there. If you have, here's an example, 97039 is an unidentified or unspecified therapy. Well, some of the carriers out there say, okay, in box 19, put a little note there of what that unspecified therapy is, okay? In Medicare, they use that for the x-ray date. Well, it's not required to take x-rays, so when would you put the x-ray date in there? Only, and I'm almost quoting here, only if you are using that x-ray as the sole evidence of a subluxation. Okay, so if you're using part, you don't even have to do box 14. I'm sorry, box 19. So if you're using part, forget about the x-ray date.
Okay, one last question. What about if a patient has a re-injury or an exacerbation? What do we do then with that box 14?
Okay, so exacerbation defined as a significant interference with activities of daily living that is necessitating a change in the treatment plan. And keep in mind, the treatment plan, the subcomponents of a treatment plan is the frequency and duration, that's one, the treatment goals, that's two, and the care plan, which means how are you going to treat this patient, is number three. So if a patient comes in and they have a flare-up, let's just put it that way, a flare-up, did you have to change the treatment plan? If you didn't have to change the treatment plan, then that's called an aggravation. If you did change the treatment plan, added in more treatments or whatever, that would be an exacerbation. In Medicare, and actually all insurances, except for PI and work comp, in an exacerbation, you would change box 14, so even in Blue Cross. The one time you don't want to change box 14 date is in a personal injury or work comp, because that's basically telling the PI case this is a different injury, and you, believe me, they will pick up on that pretty quickly and stop the case right there.
Well, perfect. Thank you so much, Dr. Fucinari, and hopefully everybody else, this helps you out with some of the dates on the claim form, and we'll catch you next week. Thank you.
Bye-bye.